The third speaker in this session is Professor Ann Kahlor from the University of Texas at Austin in the School of Advertising.
I'm gonna wear the mic because I'm short. Best for last, best for last. All right, is this thing working? Okay, good. So I'm going to try to touch on a lot of the things that we've covered so far and also sort of give us a look to the future. First, I want to talk, or I just want to recap that in terms of risk communication, thus far we've covered challenges in communicating risk. We've also covered examples of risk comm that we can learn from as case studies. And I'm going to talk about the need for baseline data that can sort of jumpstart a risk communication research agenda that's focused on PM. So the need for a baseline is because we know very little about how the public perceives indoor environmental issues broadly and particulate matter in particular. So we need a current snapshot of PM risk knowledge and attitudes. But we also need data to give us direction about how to make that information more compelling, especially to audiences that are uniquely vulnerable. And we heard about those audiences yesterday quite a bit. So I borrowed this slide from Gary. Thanks, Gary. And when he posted this slide, he said that one of the things we see here is stories of disparity. Okay? And I want to just say that these are stories, period, with a lot of plots, a lot of plot twists and a lot of details. So they're not just stories of disparity, but they're individual stories. And we need to start thinking about the stories. Communication is about stories. And what stories are you compelled to tell? And then also, who is the audience that needs to hear your stories? And when we say audience, we need to actually start thinking of smaller audiences, not a monolithic audience, but smaller audiences of vulnerable populations, for example. And so when we talk about audiences, we are a privileged group. And we need to acknowledge that in all that we talk about when we talk about audiences. So we need to remind ourselves often that only 29% of adults 25 and older have a 4-year degree. Okay? Now, that does not mean that the other 71% can't make important decisions about their health or their family's health on a moment's notice when they have to. Okay? And so we need to remind ourselves of that. 43% live in rental housing and are thus limited in actions that they can take. Okay? We also need to acknowledge that 15% of the U.S. population lives in poverty, which means that, and poverty is just defined as the state of being poor, and there's a national threshold that's determined by the number of people in your household. For one individual, it's about 11,000, and for 4 individuals, it's about 24,000, 27,000. It's in the 20s, which means they can't afford much of what you're selling, right? Just the general sort of remediation that we've talked about in terms of individual level ability to remediate. So basically, I want us to think about audiences as a plural. I want us to think about how many audiences we have and that each of those audiences needs to be reached uniquely. Also in ways that respond to their resources and their values and that understand the competing threats to their health, safety, and quality of life. Also on audiences, again, I just want to reiterate that there is no monolithic audience. And so we study the psychological and social psychological factors that are unique to a given audience. So once we identify an audience, let's say we identify that audience based on their vulnerability, based on the science that says they are more vulnerable, there's a higher incidence of X, Y, or Z in this population, then that's an audience we want to reach, so we need to understand that audience. More about their vulnerability than just that this happens to them, but more about them as a people. And so that can help us reach a specific audience with a version of our story. We have these stories to tell, a version of our story that's going to resonate in important ways. And so I study mass communication, which is basically who, right? So a source, who says what is the message, to whom, and that's the audience or audiences or stakeholders, however you want to define that, via which channel, and we have lots and lots of channels available to us today, with what effect, and that effect can be a change in attitude, a change in knowledge, a change in awareness, or a change in behavior. I also want to add that one of the things that we study when we look at strategic communication is, what does the source say and with what intention? So we as information creators want to think about and want to be very, very honest about what is our intention. Why do we think we have this story to tell, and why do we think it's going to resonate with our audience? And so being very self-conscious about the intentions. Some research questions that came up Wednesday and then again today is who is vulnerable to these risks, right? Also, what information do they have about risks? And we hinted it, skirted this, we didn't really address it, but, and what more do they want to know, right? We need to be respectful when we think about that. And what will make PM a relevant and compelling topic for them? Okay, we talked about this yesterday, albeit we would just sort of brush over it. And what risk messages would be compelling and for which audiences, right? And also, what sources do they want to get that information from? So who do they trust? Who would be a natural source for that information? And so what partnerships would be useful in getting that information out? And again, we touched on that a little bit yesterday as well. So my expertise is specifically in risk information seeking, and so naturally I'm going to recommend that we use a risk information seeking framework to study this, but I recommend framing questions with an information seeking framework because information seeking basically just means people helping themselves to information outside of a formal education setting. Okay, so we can't picture that people don't just absorb the info that we put out there, right? We have to encourage them to engage cognitively and sometimes even physically, right? To help themselves to that information. Sometimes it is a physical path that gets you to that information. And so, so we need to think about what motivates seeking, okay? So when they do actively seek, that is when people help themselves to information, they are motivated by the following. They're motivated by social norms, and those social norms play out as others expect me to know something about this topic. Okay? Another way that these social norms play out is that others also know about this topic. So there's a social pressure on me to seek information about the topic. Also risk, and we talked about risk. Bill talked about risk. And George did also. So we know that this matters, that how much risk people perceive, how severe that risk is, and then also any affective response that comes off of that perceived risk. So worry, concern, that sort of thing. Also their existing knowledge, and the reason existing knowledge matters, not because we want to be critical of that existing knowledge, but because that knowledge provides a scaffolding through which the new information needs to flow. And so, so mental models, for example, would be, and we could use the term schemas. There's lots of terms for how that knowledge is organized and what it looks like, but we need to have a sense of what that knowledge is to help filter any messages that we want to put out there. Also, how much knowledge they think they need. And so some of the research shows that a larger disparity between what I think I know and what I think I need to know to make decisions is going to drive my information seeking. That is, the larger that gap, the more ambitious I will be in my information seeking. Also then, beliefs that people have about seeking information. Is there useful information out there for me? Is it helpful? Will there be a reward for my seeking out this information and learning something about this topic? And then finally, beliefs about my ability to get that information and my ability to process that information, right? So do I think I have the capacity to understand your science if you present it to me as science, right? And do I have access to it? Do I even know where to get that information? How easily can I get that information? So this is just a model of my sort of, it's called the planned risk information seeking model. And there are other things, like it's not messy enough. There are other things that we could add to it, but this would be people's intention to seek information. And it could be, this model holds across a whole variety of risks, right? And so, one of the things I just talked about was this is the knowledge that I think I need, and we subtract from that the knowledge that I have, and this is a driving factor in my seeking information. So understanding what people know and what they think they need to know. Also, this perceived seeking control. So do I think I have the capacity, or what capacity do I think I need for your information, and how can I get my hands on it? This is an ability thing or an efficacy thing. These are those norms that I talked about. That was, you know, do I feel pressure to be informed on this topic, and are others informed on this topic? Up here, we've got my attitude towards seeking that information. That was the, is it helpful? Do I think it will be helpful? And then the risk perception that we talked about in the previous two presentations, and then the affective response to the risk. One of the things I just want to mention here, because it popped in my head and I'm not presenting it here, but there's also avoidance, and avoidance is an information behavior, and there are motivators that lead people to actively avoid information. It's not just a lack of seeking, it's actively avoiding information. And sometimes that avoiding information can be driven not necessarily by negative affect, which we usually put here, but positive affect. Like, I want to maintain hope. I want to feel happy. So I don't want to hear what you've got to say. And this is also something that we would want to think about, who would actively avoid our messaging strategies. Additional concepts of interest would be not just perceived knowledge, but also actual knowledge. And this is complicated. Some past interviews that I did with scientists working in indoor environmental microbiology, it was to try to understand the challenges that they face in communicating their science to audiences. And one of the things that came across was scientists reported, and there was a couple people in this room that were interviewed for that, that understanding is difficult when people lack a basic science, right? So you're not just explaining your science, you're explaining all of science, so that you can somehow give them the scaffolding with which to process your information. But really, we need to flip that and say, okay, what do the people really need to know? To hear your message and make meaning of it, what do they really need to know? Also, we need to look at vulnerability indicators. Age, it came up yesterday. The very young and the very old are particularly vulnerable. We need to look at life stage, because that impacts the amount of time spent indoors. So you've got more time spent indoors for very young children and more time spent indoors after retirement age. Overall health, you've got respiratory health, mobility, all of these things are factors that matter. These are all vulnerability indicators. Also community and place, so housing quality, weather factors, all of these things can also be vulnerability indicators. So any research that we would do on knowledge would need to also gather data on these, these other things that I'm mentioning here. Also, trusted sources for health risk information and for this particular health risk information. So who would people even go to, and who would they trust for this information? We can get a sense of that. And then also comparative risks in the environment, and looking at those risks in terms of social risks, economic risks, safety risks, health risks. We only have been talking about health risk, but people do not just see one risk at a time by itself, right? They're weighing all of the risks and benefits in their environment and in their lives. And then existing risky behaviors would also be interesting to get at. So what's the best way to get the data? I would start with a survey that produces generalizable data from a cross-section of Americans. But given vulnerability factors, we'd also want to sample from those vulnerable communities. And so parents of children perhaps up to age 12, because children are vulnerable, and also because parents are information seekers when it comes to their kids. So we really want to get a handle on this particular audience. Residents of disadvantaged communities, and that could be identified by zip code or county or any kind of data that we could get our hands on. I would add now, and that can give us a sense of some of the challenges in reaching those communities. I would add now also elderly communities, because that came up multiple times yesterday, and I think it would be pretty easy to get our hands on that data as well. Just to see, like, how long this would take and what it would cost, I reached out to Knowledge Networks. There's a hyperlink there if you wanted to learn more about the survey research that they're capable of. And I told them that I'd be interested in learning about a general population of adults, but also parents of children ages 12 and up and residents of disadvantaged communities. And like I said, I'd throw in now number 4, elderly. And what they said was that, so they could provide a number of completed, so they collect their data using online surveys, but for people that don't have computers, they give them computers. And so they do random digit dialing to reach a truly random sample. And then when they get people to participate, if they don't have access to a computer, they literally give them a computer and internet access. So this is a good equalizer for doing online research, because it is, when people have access to the internet, they absolutely like doing that more than they like talking to you on the phone or filling out a paper survey. So anyway, they could do completed interviews or surveys with 2,500 And that would include 1,500 of a general population, 500 parents of children up to age 12, 500 residents of designated disadvantaged communities, and then we'd also add elderly, so that would increase the sample size. But the median survey length would be about 15 minutes. They're saying they could do it in a 2-month timeline from when the PI gets the survey to them to when the data is returned to the PI for analysis, so they could do it relatively quickly. The quote they gave me was 65,000, but that doesn't include Spanish, and I would think you'd probably want to do Spanish as well. And then it also doesn't include adding retired individuals to that. Elderly or at least retired, because if you look at that life stage after retirement, you spend more time indoors. So, so anyway, that's just, I thought, why not? Let's talk logistics. So, so what can this data do? Well, it can tell us the social norms that are going to help or hinder getting information out to audiences. It can tell us patterns in perceived risk and related worry. It can tell us existing knowledge and how much knowledge they think they need to know. It can tell us also beliefs about the information that's available and their attitudes towards that information. It can tell them about, or it can tell us about beliefs about their ability to get that information, and do they think it's going to be accessible? Do they think they're going to understand it? Because all of those preconceived notions are going to impact whether they do it. And then also the trusted sources, and that might be, you know, I don't know, but I would think home improvement resources could even be a valid source of information. Building inspectors, community health workers, and then of course doctors and pharmacists, because people trust them a lot and go to them a lot for information as well. And then also, what preferred channels would people want? You know, would they want a pamphlet that you're going to hand out, or something else? Distributing the research results would be really key to make sure that you get as wide distribution as possible, and it would need to be interdisciplinary. So you would need to turn to medical and science conferences and journals, also health communication conferences and journals, and then IBE or similar journals, whatever journals you think would reach a wide distribution among the individuals that you would like to see that kind of data. Relationship building, the interdisciplinary collaboration is also key. And at UT, I'm just going to give an example. At UT, this kind of effort is housed in our new Center for Health Communication. And what makes that center unique is that we're getting a medical school, right? UT never had a medical school, which is really quite astounding when you think about it. But so we now have extensive relationships with the Dell Children's Hospital and then also with the new Dell Medical School. And communication is a part of the school from the get-go, right? Which is really, really interesting. We also have extensive relationships with the nursing school and with the School of Public Health, and we have faculty that sit on boards and panels for nonprofit and community health clinics. We also have a new affiliation with the Alan Alda Center for Communicating Science out of Stony Brook, and relationships, of course, with engineering and environmental sciences and so on. And so all of these relationships are really meaningful when we talk about getting science out to the public in meaningful ways. Finally, in terms of relationships, once we understand the audiences and their needs, those relationships can help get the messages out in really helpful, meaningful, and responsive ways. And so in summary, I just want to say that we need to learn more about our many audiences, right? We need to focus on the stories that we want to tell, and we need to tailor those stories in ways that are meaningful to audiences. And then finally, we need partnerships to help us deliver the stories in a way that resonate with place and time. So here we go.